The latest news, updates, and more from the world of health and medicine. This is Medical Minutes.
In today's Health Spotlight, the childhood obesity epidemic.
News 8's Lena Pringle explains how a leading group of doctors is hoping to change how the problem is addressed.
More than 14 million children and teens in the U.S. are living with obesity. It's a chronic disease associated with a lifetime of health risk. That's why for the first time ever, the American Academy of Pediatrics releases groundbreaking guidelines on treating children battling obesity.
When you are obese, people stare at you. People judge you.
At a time when Harley Boaz should be having the time of her life, it was literally being put at risk. At 16, Harley weighed 285 pounds.
I was diagnosed with hypertension. I was pre-diabetic. I had high cholesterol.
A new study by the CDC warns type 2 diabetes will surge 700% in people under the age of 20 in the next 40 years.
About 20% of the pediatric population now has obesity.
New guidelines by the American Academy of Pediatrics, or AAP, is hoping to revolutionize the way we approach childhood obesity.
It says we should offer all of our treatments as soon as a patient is eligible for them.
Pediatric endocrinologist Jennifer Sprague at Washington University says for the first time, doctors have a roadmap on how to treat these children.
It highlights that a watch and wait strategy is not effective.
The AAP guidelines include evidence-based recommendations such as motivational interviewing to behavior treatments and pharmaceuticals like the newly FDA-approved Wegovy, the first once-weekly weight loss injection approved for kids 12 and up.
They can make a really huge difference in patients' lives.
Studies show 95% of teens with type 2 diabetes who had bariatric surgery no longer had it 3 years following the surgery, and 74% normalized their high blood pressure.
I think there's always hope that if you treat this disease, you're going to lessen the long-term consequences.
The new guidelines also urge pediatricians to consider genetics, physiology, socioeconomic factors, and the environment. Stressing obesity is not just about weight. It's a complex issue that requires a comprehensive and personalized treatment plan.
This is the Medical Minutes Podcast. Be informed and stay connected for the latest news and information when you like, subscribe, and follow this podcast, and discover even more from the All Indiana Podcast Network. Now at allindianapodcast.com.